So much. And thank you everyone for staying around. I know it's a long day. So our company is focused on mental health. As you saw in some of the earlier presentations today, it's an area of high unmet medical need. We have two core technologies that fit into our platform technology solution. As an epigenetic test, and that really is enshrined in this idea of reveal your hidden biology. The epigenome is fluid, like your genetic structure. Changes in response to environment, to stress, sometimes adverse childhood experiences can make you predisposed to future mental illness. This is one of the traits that we're exploiting in our technology. The other is to use state-of-the-art AI, digital analysis, to get a real sense of how someone is experiencing life, experience, stress, reacting to stress. So with this, we believe we have a unique ability to do something profound, to change the field of psychiatry, do that from a reactive state to a preventative approach. So we can deliver precision interventions to people that work for them. And we can not only diagnose some types of hormonal sensitivities in women and in some men, we can also identify what type of antidepressant will be effective, not just long-term, but rapidly. Because the neurobiology we're exploiting here is the same point that serotonin reuptake inhibitors act on. We have an experienced team that kind of tracks on those three different areas of expertise. Diagnostic experience and commercialization with Sami, who is here today. AI expert Vivian Ming, and myself, who's been a serial entrepreneur, multiple successful exits. Using that and a core team of academic collaborators, really well-validated group of NIH experts. We got into the Rapid Acceleration Diagnostics Program, NIH. We have access actually to reimbursement experts, reg experts, low or no cost to us. So our point of entry for this area is in maternal mortality. Most people are aware America has one of the worst rates of mortality in the industrialized nation in the world. It provides a high unmet medical need, and testament to that is that we've already received $6.4 million in non-dilutive funding, Department of Defense, and NIH. Government wants to solve this problem. We hope that investors will join us in this mission to change the state, dismal state of care in America. But this is really just the entry point into a much larger set of platform technologies and opportunities. What's important to think about when you think about maternal mortality is the single largest driver of that actually related to mental illness. Suicidality, substance misuse disorders, all deeply connected to some sense of wellness and feelings of depression some women are particularly susceptible to. The approach we're taking here, as I said, is to use a combination of a digital analysis with a point of care test. We make money on the test. To be clear, the app, ability to enshrine and help people understand seasonal affective disorders and monthly changes in mood and personality really is a customer acquisition tool. So we don't plan to commoditize the app for about 2028 when we have significant numbers of downloads. However, it does create another business vertical which we will exploit, having some discussions with other groups who provide type of digital outreach. Opioid tracker, for example, is one example. We make our money on the test. I don't have time to talk about the biology, but I can say, anyone's interested, the neurobiology in this space, the genes we mark and test exactly correlate to neurofunctional MRI expression analysis showing connections to the pathways, the neurocircuits in women are particularly turned on, activated in maternal context. Our solution here is to provide the test to people and really to address the significant unmet medical need in this market. So estimated that the cost of postpartum depression is about $17 million. It gives us a clear opportunity to demonstrate healthcare economics to hospital systems, and multiple hospital systems are looking better for solutions. Our path to market is straightforward, a lab-developed test. We don't need to get to FDA, but we have a meeting with the FDA scheduled in a couple of weeks' time. We have a clear approval pathway and a very strong case for breakthrough status in this area, which has recently been expanded include marginalized communities that are most impacted by this. So with breakthrough status, you actually have access to reimbursement. With the Department of Defense granting, I mentioned $6 million grant. Why Department of Defense? The largest employers are women in the US. So they care about reducing their medical costs. So this is a self-insured system. They see the advantages of reducing their costs. It will actually help us do the clinical validation studies required to support reimbursement. Payers like this technology was developed a decade ago, never commercialized. I suspect if it was a male-specific test for PSA, it would have already been, developed on the market and sold to everyone. 51% of American population is women. Never developed. Decade. Help us bring this to the clinic, help women. Multiple validations, independent replication studies, now validated in 7 different cohorts, and actually shown is metabolized estradiol, applicable, and there's some publications now suggesting it's relevant major depression in men too. We have raised significant non-dilutive funding, both through this ADEX grant, as well as the Department of Defense grant I mentioned earlier. The data, and we can go into the biology here, is well validated. This is in different cohorts I mentioned before. What's perhaps more exciting is that we now have an entry point into major depression. We really have a tool that we can now start to unlock all of those different, very similar clinical phenotypes into a molecular signature we can identify and also treat. We can actually see response curves to different types of antidepressants, Lexapro compared to Zoloft. This is not a one and done test. You can go back and do multiple tests with people, show that they're responding. We can also now start to think about the role for this, for example, in EMS, in premenstrual dysphoric disorder, and as one of the earlier talks about Alzheimer's disease, perimenopausal depression increases the risk of Alzheimer's disease by a factor of 2. So it really is actually, as I said at the beginning, opportunity to create a platform technology. This is really broadly enshrined in a whole range of other diseases and mood disorders that are exacerbated in the postpartum period. Ongoing work looking at postpartum psychosis for bipolar disorder. There's also an opportunity really to get into the health and wellness space. Everyone is interested in understanding hormonal fluctuations and the changes in their body occurring each month. So this is really where we'll start to develop the app, really start to think about direct-to-consumer. So as I said, first opportunity is in maternal mortality and postpartum depression. We, with our NIH partners, they're convinced to get this to become standard of care. Most women today get tested for gestational diabetes in the 3rd trimester. We want to use this in the same clinical workflow, same test, allow women to get preparation, identify their risk factors, and move forward. As I said, there's a large opportunity for follow-on products, which we intend to develop in the next several years, including really focusing on kind of the 40 to 60 demographic of educated, well-informed women who are looking better solutions for us. So how we get, what's our traction to get that market? As I said, we already have $6.4 million in non-dilutive funding committed from the government, and actually several other large grants pending. We've raised about $1 million from insiders. We have all that we need to do to go to market. We have a chip, we have a product, we have a go-to-market diagnostic group. And recently we were invited to Mayo Clinic, go back to us in 1 week, Mayo Clinic Depression Center, to do a pilot program with them. This was around Mayo convinced us. So Mayo Clinic, as people may or not know, second only to LabCorp and Quest in terms of their reach diagnostic assays. In addition to that, there's an additional business vertical around creating complementary assays for biotech companies like Sage and Biogen. This is really exactly what they want. Launching the first products in postpartum depression is really a way of enhancing the visibility of those. Very quickly, I believe we'll be profitable by 2026. We have a well-defined set of milestones. We met with the FDA, moving forward quickly. Interestingly enough, exit the space, if you look at those numbers very quickly, by 2026, we'll be in a position to be exit valuation 10 to 12x on the investment. We're raising about $3 million. A seed round that will get us to profitability. Questions? Thank you so much.